Hi, welcome to the pharmacy. I'm Matt.
Hi, Matt.
How are you?
I'm fine.
Good. So, first of all, I'm a pharmacy student at Drake. The reason that I'm here today is to go over a new medication with you. So, I understand you're picking up today. And what's the name of the patient you're picking up for?
Joyce Smith.
Okay, and that's yourself?
Yes,
Okay.
yes.
Excellent, Joyce.
Mhm.
And so it looks like we have a new prescription today for Invokana. Does that sound familiar?
Yes.
Okay, and I see it was written by Dr. Nathanson. Is that who you recently visited?
Mhm.
Okay, and now what did Dr. Nathanson tell you about the medication?
It's for my diabetes.
Correct.
The blood sugar.
Yep, and that's right. It is going to help with your diabetes. It looks like it's also going to help along with the metformin that you're currently taking. Is that correct?
Mm-hmm.
Okay, excellent. So it looks like we are taking the Invokana 100 milligram tablets. Now, are you comfortable taking tablets?
Yes.
Okay,
Yeah.
so it looks like
Not a
you
problem.
take some
Yes.
currently. So this is just going to be another one to your regimen.
Okay.
It's going to work again for your diabetes like metformin, but in a different mechanism to help kind of excrete a little bit more glucose to keep your blood sugar levels a little bit more comfortable. So the directions are just one tablet every day for a quantity of 30. So that's going to last us a full month. As you approach that deadline, we do have 3 refills left. So it sounds like the doctor wants you to take it for the next few months. Does that sound familiar with your conversation with Dr. Nathanson?
Yes.
Excellent. So when taking this medication, it is something that it's going to work kind of in your kidney area. So that's kind of how it works. So when taking it, make sure you're drinking it with plenty of water. And along with that, it can cause some stomach upset and things like that. So if you want to take it with some food, it can help with some stomach upset that could occur. Beyond that, what kind of questions are you having right now?
Is it okay to take when I take my other medications?
Yeah. So I will need to look a little bit further into that. I wasn't able to fully come up with a conclusion on that. Looking at your other medications, I would imagine that there is going to be something that you should separate it with. Unfortunately, I can't definitively tell it to you right now. So if you can give me a little bit, I can look back and check back with you.
All right, that's fine.
So beyond that, what other questions do you have?
Anything I should look for? Reactions or?
Yeah, so something that could be kind of prevalent with this medication is a urinary tract infection or things like that. So, if you're having painful urinations or you notice kind of discoloration in your urine or things kind of going on in the urine area, I suppose, that's something you're going to want to notify your doctor about right away because this can have a little bit higher susceptibility, again, to those infections in that area. So just be monitoring that. Beyond that, that's going to be kind of the biggest indication to be on the lookout for. So that's pretty much all I have for you in that regard.
Okay. Now, I'm taking 2 diabetes medications.
Correct.
So what's the difference? They work on different things? Or
They do work differently, yep. So you have your metformin currently that you're taking. That's kind of the gold standard for diabetes. So what that one is doing is it's helping take in the glucose to your system so your body's able to use that for energy. This one works a little bit different, and it works in that you may have a little bit too much glucose in your blood. So are you someone that tests your diabetes or tests your blood sugar?
I usually just wait until I go into my doctor for that.
Okay, so your doctor is able to tell you, and when the doctor may have read your most recent reading, he may have found that it was a little high in the blood glucose range. And so because of that, this medication would be indicated in that those high levels of blood glucose can then be excreted through your urine. Okay, so the metformin is working to kind of take in that glucose and have it used as energy, whereas this one is taking care of some extra glucose that's kind of left in the blood and just excreting that through the urine to kind of make it more stable in your levels there.
Okay.
Okay.
Anything else I should know?
That's all I have really for you today. Yeah, that's all I have for you today, ma'am.
That's fine.
Okay.
I'll give it a try.
All right, thank
Thank
you.
you.
I couldn't find it in the book.